good evening, depending on where you are. I'm very excited for all of us to be here. I think that we're going to be discussing a topic that is really important and I think critical in this moment to have these conversations about mental health and burnout prevention in healthcare students. I think it's fair to say that healthcare students in general are perceived as being resilient, driven, capable of many things. But the truth of the matter is that there are intense and intensifying demands on their training that I think can have really direct consequences on their mental health. For example, I know that in 2023, I think a study published by the Journal of Medical Education stated that over 48% of medical students are reporting symptoms of burnout. And these symptoms can be perceived as a diminished sense of personal accomplishment, emotional exhaustion, depersonalization. So that this is a very concerning number, right? I also know that, and we all know that financial stress can compound all of these pressures. And according to a report from the American Association of Medical College, over 75% of healthcare students are carrying substantial student loans or student debt. So I think it is pertinent today that we have these conversations because I think that it's not only important in the moment, but all of these things will affect the healthcare of tomorrow, right? Because these are going to be our caregivers. And so I am very excited today. My name is Dr. Ilon Rincon Portas. I am the executive director at Kaplan Medical. I've been working with Kaplan for many years. I've worked with many students. And this is a topic that is very dear to me as well. With me, I'm very excited to introduce you to our group of panelists. I'm going to start with Danny Blackman, who just recently got his BSN in California State University. Dr. Micah Brown, who is academic chief resident at dermatology for dermatology at Howard University Hospital, and who's also the co-founder of the new Friedman's Dermatologic Clinic, correct? Uh, I'm very excited, Dr. Brown, to have you here as well. You will bring a student-led perspective on mental health advocacy and support and inclusive training. I think that's super important. I also have with me Dr. Catherine Flanagan, who is the BSN director at the School of Nursing in Arkansas State University. Dr. Flanagan combines academic leadership and clinical teaching experience to build programs that foster resilience and long-term success among nursing and medical students alike. And Dr. Kenneth Johnson, who's the executive associate dean for NSU Kiran Patel College of Osteopathic Medicine, a longtime faculty leader and NBOME contributor. Dr. Johnson shares strategies for institutional accountability and sustainable student support systems. So, I mean, after all of this, I am very humbled and grateful to have this opportunity to speak with each one of you. So to get us started, I would like to hear from all of you, what is your perspective of what are the one or two things that you think are contributing the most to the stress and burnout of our students? If you want to start, whoever wants to start first, maybe Danny, you want to kicks us off?
Sure, yeah. Um, Also, thank you for letting me be here. This is an incredible honor to bring my perspective as a student. And I'm 4 days away from graduation, so I'm about as recent as you can get. It's very
Bravo.
exciting. But I think it's important for us to remember that, it's not just a topic, it's a lived reality. It's something that I hold very dear. I came into my program as someone who was already dealing with a recent mental health crisis. And if anybody from my programs on the call, they'll understand, they've heard my sob story. But I lost my home in a wildfire right before starting the program. And I would be lying if I said that I didn't worry coming into it whether I would be able to stand up to not just the academic rigors, but the mental and emotional rigors that the program, a nursing program, puts you through. um, because it is challenging academically. It does challenge you emotionally, physically, mentally, and I feel like there's almost this perspective that um, being able to struggle through is a badge of honor, but I don't know if I want to normalize exhaustion or anxiety. I want to try and find strategies to help uh, kind of check these mental health crises that can happen and the burnout, because it's not sustainable for our career. We're gonna lose practitioners that way if you're entering the career already feeling burnout. So it can be a barrier to learning empathy and safety. So I want to try and help it stay as grounded as possible and come up with perspectives and ideas that can help students to feel more comfortable as they are going through the program, but also as they exit and go into professional practice as well.
Well, Danny, thank you so much for sharing your story. I think that for me, one of the best things that we can do as educators, as part of the healthcare system in general, is start facing head on the stigma that a lot of mental health issues have. I think that historically, as healthcare workers, we've been seen as, almost superheroes that have no feelings and have no space for that. And so I think talking about our own mental health struggles is a very brave and I think a very good first step so that we can start with the stigma issue and having really good open conversations. So thank you for that. And I'm hoping that you're going to celebrate your success because it is also one of the things about mental health, I think, is celebrating when we do good things. So take the time for that. Um, Dr. Brown, can you share what are two things that you think are really important in terms that are things that are affecting mental health in our students these days?
Yeah, I'm definitely going to get to that, but I wanted to comment on what you said because I definitely feel like because a lot of people that are in the health professional field, where a lot of us are type A, we're, been the top of our class for a majority of our lives. So when we kind of go into these high pressure, like stressful and, environments, we're kind of like, okay, I'm not good enough. Everybody here is smart. So how do I stand out? So sometimes not sometimes, a lot of times that imposter syndrome kind of creeps in even when you don't really want it to, or even when you're kind of don't really acknowledge it, you're kind of well, for me, when I was in medical school, I was kind of like, okay, well, I'm not doing as well as I want to, I wish I was doing better. And then you kind of negatively think about yourself and like your capabilities and everything. And I remember in medical school, had just gotten off like a long like study examination period, and one of my teachers was like, I feel like the energy is low in this
Mhm.
class, like what's going on? And we were all just like, we feel very much less than, we feel burnt out, we feel like we're not smart. And she was like, do you guys know that you're in medical school? Do you guys know that you are studying to be doctors? And I feel like that's really important for all of us to do, whether you're nursing, any, medical, any type of, medical professional. I feel like it's really important to kind of take a step back sometimes and realize, no, like I prayed for this, I cried to get to this position, and I put in a lot of work. So that's even something that I have had to, work on in my own mental health is kind of like, appreciating the wins and taking time to maybe write down things that I've accomplished this year that I didn't accomplish last year, just to be able to really see it in plain view and be like, okay, I I am farther than I was last year. So that's something that I should be proud of. So that's just something that I wanted to say. But one of the biggest things that I think contributes to burnout in medical students and just like medical professionals, um, is the lack of work-life balance,
Mhm.
honestly. And it's hard sometimes because when you're in school and you're like, okay, I have to just school. I came here for school, so that's all I have to do. But a lot of times when your brain is so consumed and constantly thinking about testing and everything, we kind of lose ourselves, right? And we kind of forget to do things that make us happy and forget to call our parents or forget to go to the gym or even just like spend time with our friends because we're like, no, I have to study. But I have realized that when I am intentional about incorporating self-care and the stuff. Granted, self-care looks different for everybody, you know. Self-care for one person could just be hanging out with their dog, relaxing on the couch. Self-care for someone else might be going out and being active, you know. So I think it's important to figure out what self-care means to you, because it's different for everybody, and then be intentional about scheduling that into your everyday life or every week life.
Agreed, 100%. I think that it is true that the balance is really hard because there's so many competing priorities. Um, I was doing a workshop a few weeks ago about timekeeping and time management, and I read a lot. I listened to a lot of podcasts and watched stuff. And one of the things that really stuck to me was somebody who was very successful who said that we always needed to schedule in the important things and the things that we like to do, because we put that as secondary, sometimes tertiary, as part of our lives, and so we miss on a lot of things. So thank you for sharing your experience as well. I think it's super, that question of balance is super important. um, Dr. Kenneth, Dr. Catherine, want to share what you think, what your experience has shown you about these issues?
Yeah, I love what Dr. Michael was saying about being intentional. And we try to teach nursing students at the very beginning, be intentional, create that schedule, develop that work-life school balance to have the best program possible. But with nursing, nursing is very quick. And depending on what program, you may complete a program in 12 months or 3 years, depending on what options the university has. But with being faculty, sometimes we don't know how to help students if they don't come forward. So encouraging students to be open, to be thinking, and come talk to the faculty, because we know resources that are available on the campus. But if we don't know those struggles, we don't really know how to help. And we have those capabilities for counseling on campus, and being able to distribute those resources is very important.
Very
Yeah,
interesting. Go ahead.
yeah, I couldn't agree. I couldn't agree more with what everyone has said. It certainly highlights something I think at an institutional level is one of our major threats. All of these things we all have talked about make up this crisis that we've been talking about now for 10 years. At an institutional level, let's call it a hospital, or in my case, a university, Nova Southeastern University. I think we're looking for leaders that will take what we already know and implement the solution. So one of the two biggest threats institutionally that I perceive, and I think Nova Southeastern's done a great job, and I'll tell you why in a minute, but we haven't implemented the solution. So this crisis is gaining momentum, unfortunately, even though we've defined it very well, and many of us who are leading the fight to prevent burnout in students, residents, and physicians, nurses, healthcare workers, we've just taken a little longer than I think is healthy. So we need to pick up the pace, number one. And number two, what everybody mentioned falls under what osteopathic medicine really highlights, which is a holistic approach. Certainly, we can help individuals prevent burnout, and we should, and that should be a solution that has already been implemented. And certainly, institutionally, this solution that we're all looking for, this prevention, if you will, needs to be holistic. That being said, Nova Southeastern University has 7 core values. 2 of them are actively dealing with the solution we're talking about. 2 of our core values are being student-centered and community. Those 2 core values are stressed by the Board of Trustees at Nova Southeastern and the president, Dr. Harry Moon, such that we are implementing at the curriculum level the holistic approach that I think all institutions should speed up and implement.
Excellent. I have a follow-up question for you, Dr. Johnson. What do you think is the reason that there's been such a delay in so many years? Because this is obviously, as you said, not a new thing. I would also like your perspective, Dr. Flanagan. Why is it taking us so long to talk about these and actually start, working hard to implement things?
I couldn't thank you enough. If I don't say anything else today, that's my dream question. Why have we taken so long? And to be frank, putting on my finance hat, I don't think anybody realized what it's going to cost us, what it's going to cost us in individual lives, i.e., the student, the nurse, the physician. I don't think anybody, especially, let's just say, pick on somebody, hospital administrators, what it was going to cost them. This 50% rate of burnout in students and physicians and nurses and healthcare workers is a real number. It's probably underestimated when we're talking about a crisis. And it's going to be extremely expensive to fix, but if we don't, the costs are going to be astronomical, as they already are. We're trying to hire physicians. Guess what? The physician shortage due to burnout, i.e., we've lost 50% of physicians, for example. I know it's the same number for nurses. We can't find them. And when we do find them, fortunately, they've educated themselves with programs like this such that they are asking for that life balance that Dr. Brown was mentioning. They come to us saying, I want a full-time salary, but I want to work part-time so that I can stay well. And those are the docs we hire.
Mhm. Thanks.
Dr. Johnson, it's so interesting that when you're talking about, you know, how many medical professionals kind of admit to burnout or, the percentage, but I feel like a lot of us don't even realize that we're burnt out, me included, because it's so funny because when I was asked to be on this panel, I really just sat with myself for a while and I was like, wow, they're asking someone who's currently burnt out to talk on this panel about burnout and mental health.
Hmm.
So I was just kind of like sitting with myself and just thinking about everything and even talking to some of my co-residents, because if that's one thing that I can say, try to find your people in whatever school you're in. Like you guys can bounce ideas off of each other and study together, but most importantly, you can just be there to just like hold each other accountable, like lift each other up and all of that stuff. But we were just talking and we're just like, wait, are we burnt out? Are we burnt out? And I'm like, okay, well, let's ask each other questions. So when's the last time you did like you played tennis? And they were like, oh, that's been a while. Or like, when's the last time you like cooked yourself a meal? Oh, I don't know. So a lot of times we just get really good at compartmentalizing and just like being just go, go, go. Like I feel like a lot of people in medicine are honestly burnt out, and that looks different for everybody. So I wonder what the actual percentage is. Yeah.
Well,
Hmm.
fortunately, Micah, it is preventable. And as a physician, you diagnose and treat. And diagnosis is now well established in all this great research, the AMA, the AOA. Most of the major colleges have done independent research. And so we know how to diagnose it. And that's the key to treatment. And treatment is relatively cheap. Don't isolate, eat better, treat your spiritual self well. If you don't treat your wellness, you will be treating your illnesses. And so it's highly motivational for us to diagnose and prevent.
And I'm just really curious, how do we get there? Because I am admittedly the world's worst person at taking care of myself when I'm in an academically rigorous program. And this is my second degree, but honestly, my first degree back in England pales in comparison to the amount of work I had to put in for this. And I just didn't ever feel like I had the time or really the energy and capacity to do the things that I love. I think it was Dr. Flanagan earlier maybe mentioned, calling parents, or maybe it was Dr. Brown, I can't remember. you know, my parents are here now for graduation, but I hadn't spoken to them for 6 months because I didn't feel like I could give up that time. So how do we get students to the point where they can kind of change their mindset, change their perception, say, no, I do have time for this, and this is a good thing for me to do. It just feels, right now, it feels like a hard shift to implement. So I'd be interested to hear people's perspective on that.
I think that is very interesting, and I think Dr. Flanagan, if you want to go.
Yeah, I think part of that also, the faculty need to retrospectively look at everything. What assignments are being given? What is a meaningful assignment? You know, we tend sometimes in education want to hold on to something because that's how it's always been done. But what new and innovative ways can we look at providing this education to students to make it meaningful learning, but not overwhelming and over testing students, over giving assignments, because that is what's consuming students' time, that gives that thought process of I'm too overwhelmed to even call my parents and give them an update. So what can we do as faculty to make adjustments in the curriculum that will still benefit the students? They'll still leave with the knowledge they need to be successful on their boards and be the best practitioner possible. But is it all really necessary? So that delivery of the education, because if we're piling too much on, we're adding on to almost that emotional exhaustion. And it deflates that self-efficacy, the belief that you can do it. But when you're just almost on a hamster wheel, you kind of have that disbelief, which could relate to increased burnout.
Yeah, I agree completely. One of the answers to your question, Daniel, that we've solved, two things. We're creating a culture that's determined to help prevent burnout. Okay, we're a university with 9 healthcare colleges. So culturally, we say, if you see something, say something. I mean, that's not our saying, but it works really well with mental health, with addiction, and with burnout. So if you see something, say something. So faculty are trained, students are trained, student leaders are trained to identify students who may be in trouble. Doesn't sound novel, but I can assure you that it isn't happening nationally or globally. And number two, we build into our curriculum a wellness course, and so our students meet once every other week for a wellness hour. And these issues are addressed, and it has an impact. There's peer pressure to support each other, peer pressure to seek help, which none of us have mentioned it, but one of the big barriers is learning to seek help. And our students are dealing with the stigma of burnout the same way they deal with stigma of mental health. They don't want to say anything. And so working through that stigma is a problem. Daniel, if you're burnout, you have to tell someone, and then you have to get help.
I appreciate these comments, because I think what we've all been talking about is a cultural shift, right? I think in the past there's always this message, which is not a message out that's said out loud, but it's like, I think in the past it was very, if you are crying because you're exhausted, or if you are feeling this kind of way, maybe this is not the career for you. You're not, you're not cut out for this kind of stuff. I personally heard that several times while I was training as a physician as well. And so there's this a very big historical expectation, right, that healthcare students in any capacity have to have superpowers and plow through, because it's not only right, the academic thing that I really love your answer, Dr. Flanagan, this rethinking of how we can teach, right? We have so many new resources. We can do the learning piece, I think, a bit easier than at least way back when I was studying. So I think that there are many things that we need to rethink. That's I think a great start. But what about the rest of it, right? Because it's not only we are being we are witnesses of some really incredible stories and horror stories and really hard stories with our patients. Where do we put all these things? And I think historically our message has been, well, do, compartment, put it in here and then move on. But maybe that is not necessarily the solution for the moment. And so how do we shift to so that we can all move together in this way? So I would like to hear your thoughts as a student, for example, Dr. Brown, Danny as well, Micah, if you can share in your experiences as you were, getting your degrees and everything recently. How did you feel this? How do you have any ideas or thoughts on how we, faculty and institutions, can best support this culture shift? Maybe if we start with you, Micah.
Yeah, sure. So it's very interesting because in medicine, I feel like a lot of times I would hear from attendings, well, when I was in medical school, we did this. And
Mhm.
when I was in medical school, we never questioned our attendings and we never, we always stayed late, even past duty hours. All of these things. And so I feel like it has to start with our superiors kind of getting away from that old style of medicine, because honestly, we're not really able to give ourselves to our patients wholeheartedly if we're not
Mhm.
full ourselves, and if we're not taking care of ourselves. And I honestly feel like the best type of physician or caretaker is someone that is taking care of themselves first and foremost. And so even recently, we have it's like this unspoken word in medicine where you have time off, but you're not really supposed to take it. And so I remember dealing with some family things and just wanting to take a couple days off. And, I got a little bit of slack for it, and I was kind of just like rebutted with, oh, and when I was in residency, we didn't really take time off. We didn't really do all this stuff. And then I was just like, that has to stop. It's like that type of mentality that we just have to continue to give and give and give and not give to ourselves has to stop. So that's one thing that, our attendings and superiors can do, is just kind of get rid of that old mentality and kind of just adopt this new era of medicine where the physicians are cared for, by themselves and they're doing a great job at caring for others.
And then
Thank
there's,
you.
you can take time off, but are you truly taking time
Mhm.
off? Because for me, I'm always still in here. If I'm on spring break, I'm constantly thinking about nursing schooling. Okay, what's coming next? What do I need to be thinking about? What do I need to be planning for? Um, but I think it was Dr. Johnson that said it earlier. You mentioned isolation, and I think that's the biggest thing that faculty can do. They can create a culture that's it's almost sort of family oriented, very sort of arm around the shoulder, community based. Uh, if you set up that culture with your students, they will take it forward. And I think that's something I'm very proud of at Sacramento State. It's something that we do. We have a robust student-led mentorship program where upper class people will take on a mentorship role with a single first semester student and just help them, combat some of the struggles and the barriers and uh, give them hints and tips and resources as to how they can succeed in this program. I think that's huge, and it encourages this uh, culture of giving back. And I think that these students then take that on into their professional practice as well. And I think that can only be helpful in terms of reducing burnout once you get there as well. Uh, but you're right, Dr. Brown. It has to start off with the faculty creating that culture and encouraging the students to then run with it, because they'll take it, because they want to feel good about themselves, right? And it does feel good to help other people. We wouldn't be in this profession if we didn't feel that way. So that's a good starting point, I feel like.
Excellent. I agree with you. I think that the part of isolation, right, when we are studying all of our mental health issues and stuff, depression, one of one of the things that you see is isolation. And sometimes people who are having a depression bout, is really hard to get out of there and get the help that you need. So I think that having the resources and the channels open and already established, as you're saying, Danny and Micah, so that that the student actually, when we're starting on this downslope, they can have access very quickly to that kind of support. I have a good question I wanted to ask um, from sunny upstate. I think this is for Dr. Catherine and Dr. Kenneth. How do you find the balance, on one hand, teaching and supporting wellness, and on the other hand, not using up all the students' precious free time while training the wellness part? This person said that they were once invited to a wellness meeting in person at a 7 p.m. Time on a Thursday.
Catherine, I'll let you go first.
It's hard. It's, because you're trying to fit wellness, you're trying to fit everybody's time needs, their other personal commitments, because even as educators, we have families, we have lives outside of work that we're trying to balance, but also trying to meet those needs of those students. So even like orientations that would maybe be online where the students have access to it, provide them those resources on campus, provide them different local resources. You may have students new to the area, and provide them with those connections that they might need to feel supported in the community. And then they can balance their personal wellness on their own time. But setting up an appointment at 7 p.m. on a Thursday, I wouldn't do, because that doesn't work with my work-life balance. I'm trying. So it's a very precarious balance.
I agree.
I was going to say the same thing, but it's interesting. Think about the students who complain about the 1 hour wellness, where we're teaching them how to avoid a crisis, not only for themselves, for our faculty who are required to come to the wellness hour. We're forcing them to do wellness, if you will. So the students that complain are the very ones who are at the highest risk. They don't want to stop studying ever. And so why are you doing this to me? It's like, because you're going to thank me later. You're going to need this. You really don't understand the potential for burnout in the future. So it is a balance, but I'm glad that we require the course and that we require it for our faculty.
Now, I have a question for the recent grads. Were you aware of, of the institutional resources where you went, and were they perceived by the students as accessible, confidential, and like actually helpful? What do you think could have improved the experience in this way?
So when I was in medical school, my third year was when COVID happened. And so before that, I honestly wasn't like, our school did a very good job at providing academic resources, so tutoring and all of that stuff. But when it came to mental health resources, not so much, right? And so when COVID happened, a lot of, we were studying indoors, we weren't allowed to go out, a lot of our step exams kept getting pushed back, pushed back, pushed back. So we're studying for almost 8 months, 9 months, and as a collective, we just were not okay mentally. And so a lot of us got together and talked to our deans, and we were just like, listen, like, we can't even perform like we need to perform, because we're just burnt out. And our families, are getting sick. People are, dying everywhere. COVID was a crazy time. And then if you add on the added stress of just existing and being in medical school and trying to also do your best, it was a lot. And so thankfully, our deans kind of put together free mental health services for us, and free online gym memberships for us, which was like life-changing. But it did take kind of that pandemic to kind of, shed light on it. So, I mean, that was one thing that was one positive thing that came out of that. But it was nice because that was actually my first step into therapy, was that. And so I'm definitely grateful for that experience, because now I go to therapy regularly. But that was my first experience, kind of just getting that free therapy. But it took us honestly coming together as students and just talking to our faculty and being like, I hope you'll listen. And they did. So that was nice.
And I have to say, Dr. Brown, I'm impressed by your boldness and bravery at, approaching your faculty with that, because that was one thing we were talking about. I mean, getting over that stigma to be able to feel comfortable approaching, people in positions of power with our perspective and our concerns, because I don't think that's easy.
No, it was very difficult. It was very difficult. It took a couple of meetings among my classmates and writing things down, and no, we don't need to say that, or we do need to say that. But I mean, we're our strongest selves when we work together, right? And we're able to move mountains when we work together. And so that's essentially what happened. And I'm just glad that they were responsive.
100% agree. I mean, that's the community based programming I'm looking for as well, and what I try to support. But in terms of the resources at my university, the faculty are very open with the resources that are available, and there are plenty of resources available on campus. They do have free therapy sessions. I think there's a limit of 10 a semester, but they are there to speak with a mental health professional should you need it. The faculty are also very available to have those discussions as well. I had a situation where on my last clinical day in my first semester, my patient coded and ended up in the ICU, and I wasn't invited into the debrief on the floor. So I didn't get a debrief while I was there in clinical, but one of my faculty found out about it and approached me and sort of sat me down in the sim lab room for an hour, and we had our own little debrief about it. And she didn't have to do that, but she took it upon herself to come find out, hey, how are you doing? What can I do for you? What resources do you need, if any? The one thing I'll say though about the resources, even though they are there, I do wonder, again, related to the stigma surrounding mental health, how many of the students are actually using them? And particularly for my school, because we're off the main campus, we have our own little mini campus. So we're not on main campus where those resources are located. So I wonder how many students are actually taking the time to go over there in their tight schedules to seek out those resources. But in terms of, are they available? Are we aware of them? I would say absolutely for our school. They do a really good job of going over them every single semester. So I'm always quite pleased with that.
Thank you, Danny and Michael. This is very helpful. For Dr. Johnson, Dr. Flanagan, I have a question. We do know that there are sometimes part of our faculty members who are not as, let's say, believers that there's an issue with mental health. They don't want to prioritize. They don't think it's a problem. They feel like it's a personal thing that students should learn how to deal with themselves. How do you tackle this? How can we help make sure that even individuals who are in positions of powers in these institutions are actually giving the space and providing the support that our students need?
I'll answer first this time. I really believe strongly that the answer to that question is very specific. It starts at the top. It really is a leadership issue. Our new president is a surgeon. It's the first time we've had a physician as a president at the university. He is a healthcare provider. And so I know at the top, he's going to prioritize this issue, and the rest will be history. So it starts at the top.
I completely agree. It starts at the top, and we're advocates for our patients. We should be advocates for our students as well, and looking and seeing what those needs are. I've been in education now for 12 years, and I've seen a lot more students come to faculty with concerns, with that burnout, with those mental health needs. And I've seen it more and more, probably more since COVID than pre-COVID, but they are starting to reach out more. And that's leading faculty to realize, hey, there really is a significant need. What can we do about it? And some of it does have to be handled at the department level because program options can be very different, but those faculty that tend to those students, what can we do? What thought process can we have? How do we bring them in? And like Danny said, debrief after a code and really help students process what they're seeing in clinic, because some of them have never seen anything like that before. And they go into the clinical setting and they may even have self-doubt. Do I belong here? Well, let's talk through, what did you see? What were your thoughts? What were your feelings? How were things handled? And that can be handled, in the department without even potentially even referring them. And then of course, referrals if, depending on the severity of an issue.
And I think
Dr.
something that I struggled with in terms of my perspective, in terms of how it was handled, because my clinical instructor, not only did she not advocate for me to be part of the debrief, she didn't give me her own debrief. And the only thing we really covered in clinical post-conference was how excited she was that one of my student colleagues had the opportunity to do test compressions. It just felt like we were focusing on the wrong thing in the moment. But yeah, just figuring out how to change those thoughts and mentalities and support those sorts of debriefs, because I do feel like they're absolutely imperative. Otherwise, you're just sitting with that trauma and building upon it, which is not.
Yeah. And those types of events are incredibly traumatic, especially if maybe that was the day before a large test and you had a long clinical day, stressful events occurred, potential poor outcomes. How does that affect the student the night going into a test? It's unavoidable with clinical placement issues when clinic occurs compared to tests. But, encouraging those students to reach out. I had a student reach out, had a horrible clinical day, and it had a code. And, I was willing to work with them because they were struggling mentally and I could tell. And I was willing to work with them for an exam so they could have time to focus, because if they're distracted from one event, they're distracted in their learning and then their ultimate performance. So being a compassionate, open-minded faculty member is helpful too. I mean, rules are rules, but we can work with people.
Yeah, we have a it's not a new initiative, it's a big initiative, and that's our interprofessional education. And if you think about what happened to Daniel and how it actually integrates into the crisis of burnout, here's a practitioner deeply involved in the care of a patient who's, due to lack of, let's just say, lack of interprofessional education in this particular case, was left out of a debrief. And what the impact was, not only probably for the team who didn't get the advantage of Daniel's input, he was the key clinical provider, and if you weren't, that's okay too. But and then the patient. So those two crises in medical education, we can help each other by making sure we do both.
Interesting. I really like this. And so I want to follow up with a question like, how can institutions, schools, hospitals proactively identify students who might be struggling, rather than just wait for the student who is probably, the moment that they're reaching out for help is because they're already deep down on the struggle piece, right? So how can institutions do a better job? What are your recommendations to do a better job to identify these students and making sure that A, they get the support they need, and B, they don't become identified as a problem for the institution?
Yeah, I can comment on this. I wanted
Yeah.
to, it actually is perfect because I was gonna second what Dr. Flanagan said about like how debriefing is vital in just everybody's, experience. But I also think that explaining situations and talking about possible outcomes before things even happen could also kind of prep students as well. I remember when I was in anatomy lab for the first time, and I've seen, dead bodies and things like that before just because, of my undergrad experience. And so this was new, fine for me. But then there were a lot of my classmates who were traumatized, honestly. This was their first time. They were just given the instruments and, we were supposed to saw into a brain in half, And so I remember going to the bathroom and seeing one of my classmates just bawling and crying. And she's like, wasn't expecting this today and all this stuff. And I'm like, what? I consoled her in that moment, but it was something that stuck with me because I'm like, you know, a conversation beforehand could have probably just made the experience so much better for her. So to answer your question, I think it's really important in that orientation period to set the standard for the year. A lot of times we talk about academic expectations, we talk about, curriculum and all these things, but I feel like it's very, very important to be like, listen, I have been in your shoes before. I know that this maybe even being super vulnerable with your students. I've been burnt out. I've, given everything to be in this position. And while I love medicine, I understand that sometimes it can be stressful and you kind of give up yourself a little bit. And so, I want to make sure that we have a culture where we can talk and where we can be vulnerable and all these things. I feel like talking about it in the beginning would kind of help to set the standard and make people more comfortable.
I'm going to piggyback off of that. We have the faculty are providing those expectations, but that student to student interaction with somebody that's been in the program, they've been the boots on the ground in that program, they've lived it. And being able to share that with new students, they feel like they can relate more, I think, to other students than maybe faculty. Now, they are not going to come to them necessarily with those concerns, but they recognize, okay, this is what's coming. This is what I should expect from that perspective. Because just giving the faculty perspective is great, but that student feedback, that student interaction with upperclassmen, I think is very helpful for those expectations.
Absolutely.
Yeah, we have two programs that mirror that. One is our academical society. So all of our students are broken down into groups of 20, and we have two campuses here in Tampa and one in Fort Lauderdale, a larger campus in Fort Lauderdale. But we have 10 academical societies consisting of about 25 students. The second years stay in their society and then become peer mentors for the first years. So exactly what you were talking about as far as peer-to-peer is part of our organizational structure.
Daniel, do you have any thoughts?
I think they said it very well. I don't know if I have anything particular to add to this question beyond what's already said.
Okay, great. So maybe I'll continue with you, Daniel and Micah. What personal coping mechanisms or strategies you found the most useful when you were dealing with some of these things or are dealing with some of these things? Dr. Brown, you said you feel that you are burnt out right now. So what are you going to do? What are you doing to help yourself? I think from the beginning, right, we're trying all to share some of our own experiences, to start the work here today, even like opening up about these topics. I think is incredibly brave and helpful.
I absolutely it's interesting because I it's like you work so hard in medicine and you work so hard to become a nurse or a doctor, right? And I've been really trying and working with my therapist to put that much work into myself. I feel like it's very easy to just keep giving and giving, but I've had to really sit myself down and whether that's writing to-do lists and everything, because sometimes with me, I can get overwhelmed with all the things I have to do. And I'm like, oh, I have to do this and I have to do that. But even when I was a young girl, my dad would just sit me down and be like, okay, let's write a to-do list and knock it off one by one. It's a very simple thing. But for me, kind of seeing that, okay, I did this, cross it off, it just like kind of eases me a little bit. I mentioned before therapy, it's been life-changing for me. Just to have someone that's, unbiased and doesn't know you, but can kind of help you navigate medicine, I feel like is very helpful. And then I mentioned before, but like planning time to unwind. It sounds very, like I'm doing a lot, but honestly, like I will put in my calendar, okay, when you get home, just sit on the couch for a little bit or go for a walk. And just as intentional as I am about doing that Anki or, you know, reviewing those PowerPoints, I need to be intentional. The same intentionality with, you know, being you know, nicer to myself and speaking life over my, you know, over my circumstances and things. So yeah, it's a work in progress. It definitely is. And I don't want anybody out there to think that this happens overnight, because it definitely doesn't. You know, there's sometimes when I'm just like completely overwhelmed and I'm stressed out and I'm just like, nobody understands what I'm going through, you know? So I'm talking here today, but as a work in progress. But I'm definitely in a way better mental state than I was in medical school. But honestly, I just think that's time, a lot of therapy, and a lot of prayer, honestly.
Amen.
I
Amen.
think it is a lifelong process, right? Figuring that out. And I mentioned this at the start, that I'm the world's worst person at taking care of myself during a program like this. And it's funny because when I'm taking up my mentorship role with the students coming behind me, that's what I tell them. I say, make sure to get good sleep, eat well, do the things that you love. But then I didn't do that myself. So it just feels, I don't know, it's a weird situation. But for me, my big coping mechanisms, and we've all said it, but it's having your people, right? And hopefully that's, a partner or a family member. It's a little difficult because they're unless they are medical professionals themselves, they may not fully understand exactly what the student is going through. So for me, my main support network has been my clinical cohort. So a group of seven people who have supported each other throughout the entire program. If I have problems, if anybody has problems, we go to each other. We have our own little mini debriefs about situations or things we're going through, and it's helping to stave off some of that isolation we were discussing earlier, and um, going to someone who understands our perspective and what we're going through, and can help us think about things in a different way, perhaps, and get to the bottom of what's impacting us. Ideal world, we'd all be doing the things that we love, but I think you have that sort of trauma bonding atmosphere where these are the people understand what you're going through, have a perspective, and can help you come up with strategies to support your mental health and hopefully try and prevent some of that burnout. And it's definitely not easy, but it's something that it's been really important for me to strive to promote that in my program with the students coming behind. You do not get through or most people aren't going to get through these programs alone. It's just,
Right.
I don't think it's reasonable. I think you need that support network. And I think that's your coping strategy right there.
Agreed. I love what you're all saying, because I do think, for myself, I graduated many years ago, and I am just recently, like this year, finding ways that are helping me cope with my own burnout and my own experiences of life, right? So I think that it is important. The community piece and the isolation piece, I think, are vital in these issues. I think finding the moments and finding the things that, for me, it's surprising. I started this year doing a journal through drawing, and it's been I'm going through a lot of things in my personal life, and I find it that taking 10 minutes to just draw what I'm feeling or whatever has been incredibly helpful in grounding myself and then being able to breathe and move, right? So it is a work in progress. So we have 5 more minutes, and I could talk with all of you for more hours. I think it's wonderful, all your perspective. I'm incredibly grateful to have this opportunity to talk to all of you. But I would like to leave and give you all the chance, 1 or 2 minutes of what advice would you give your young self, and what is one thing that you're going to sort of pledge to do moving forward so that we can all start moving forward in this issue and this cultural shift that we all want and need? Maybe Dr. Johnson, if you want to start us off.
Sure. I vow to negotiate with leadership to never tolerate what is obviously a culture that supports and encourages workaholism. Um, we're working too hard, so less is more. And so I vow to continue to be a voice with medical leadership, that it's no longer acceptable to ask a healthcare practitioner on his job interview, would he be willing to see 60 patients a day? And I understand that that's still being done. That's just unacceptable.
Thank you, Dr. Johnson. Really appreciate it, and I really appreciate your vow. Dr. Flanagan.
I look at how to advocate for the students, but also how to advocate for the faculty. Faculty are as at high risk of burnout as the
Yes.
students. Sometimes we encounter trying situations and challenges we never expected with the student population, and how to balance that, how to advocate to leadership of problem solving, and what solutions can we bring to the table to help not only students, but also our faculty as well, because burnout in the faculty is just as real as with the students.
100%. Thank you. Micah or Daniel, who wants to go first?
I can go first. And I appreciate what you're saying there, Dr. Flanagan, because I'm very fortunate enough to have a really great relationship with all the faculty. I was on their undergraduate committee for 2 semesters, so I developed great relationships, and you're able to have those conversations and understand their perspective as well as to why it's difficult for them to provide all the support necessary. But I kind of jumped the gun a little bit. I would say that we are always stronger when we're connected, and that goes for the student groups. And I'm not just talking about individual cohorts, I'm talking throughout the cohorts, encouraging that connection, but also encouraging that connection with the faculty too. And it can be just little simple things, whether it's the peer mentorship, whether it's just simply asking someone how they're doing after a tough exam, or trying to get to the bottom of what's going on with people. Because I honestly think that things like mentorship and community, they aren't luxuries. They should be necessities in these programs. We all need to find our people, be open to talk honestly about the struggles that we're having, and try and create the kind of environment that the next generation of students will be grateful to step into.
Excellent.
Okay, so I wish so badly that I could go back and tell myself, you're going to be okay. Like the path may look a little different than what you imagined, but ultimately you'll end up exactly where you're meant to be and where you need to be, and to trust the process and like stop carrying the weight of worry all the time. That's what I would definitely tell myself. And I do vow to be more open with my co-residents and even medical students and pre-meds, like just being more honest about my insecurities and willing to share the challenges I face, because it's not all glitz and glam. I've been through some things, to get to this. So I vow to be a little bit more transparent in my challenges. And then I also vow to celebrate the small wins for myself. Um, recognizing recognizing progress, even when it doesn't feel perfect or doesn't feel like progress. Any progress is progress, right? So.
Thank you. Thank you for that. And while you're giving yourself that advice, can I ask you to give my younger self that advice as well? It'd be great. Well, thank you for your time. Thank you everybody who joined us today. I think it was really great conversation. We will be sharing a recording of this video. I think it's really important for our panelists. I really appreciate stay in touch. And Daniel, congratulations in your your success very soon in the next few days. I hope you are celebrating. I'm sure your family, your friends, your peers are going to be very proud. We are all very proud of what you're doing. Thank you truly for this, and I'm sure we'll be seeing each other.